ways of working together, but also going to tell you about some material that we've got online, some of which you will have gone through in your previous sessions. So what we now call phase 1 and phase 2 materials around reliability, complex systems, all of which are like Carrie's micro teaching, less than 5-minute videos with slides. Secondly, is some material that's relevant to this particular stage in the collaborative, one of which I'm going to give you now, and then there's another one that's going to be loaded up in the next couple of days around a book that you might all want to read called Switch. But I've sent you the link so you can just read a very short version of the book if time is short, which is has been to many other teams in many different collaboratives a real game changer when they realize that actually there is a mechanism to making change both successful and sustainable. And it's not just about data, it's really about people wanting to change and taking small steps to do so. But what I'm just going to run through now is some slides on a concept you may have heard of that was developed by psychologist Edward de Bono, which talks about what he calls thinking hats. And what this does, really, like Carrie has just mentioned, is recognize that we all, by our personal genetics, nature, upbringing, have a tendency to think about a situation in certain sorts of ways as a preference. And in a team of people, you are going to get a mixture of people who will think differently about exactly the same situation, circumstances, and data. And sometimes that can create challenges in the way a team works. But de Bono thought very long and hard about this, gave the hats colors and characteristics. And then, as the reference that we've sent you suggests, you can use this in 2 ways to become a better team. First of all, you can look at a situation all trying to wear the same hat, even if it's not your natural tendency. And that gets people comfortable with thinking outside their own what normal ways of thinking. Secondly, is you can all adopt a hat in a situation, and using the prompts I'm just going to run through now, perhaps act as if you had a yellow or a green or a blue or a red hat, even if you tend to be a white or a black hat person. And I think when I describe the characteristics of the hats, you'll perhaps recognize some of them in yourself, and you may recognize some of them in the other people that you work with. There's no evolutionary advantage to having a one hat or another hat, and it's not a criticism of people's intelligence or anything else. It's just the way we are made. It's another human characteristic which has added to perhaps the richness of the human form, but also perhaps to our ability as a species to be so successful. But we're successful when we recognize and appreciate these different characteristics rather than when we try and compete against them. So next slide, please. So the first hat, which probably is a bit overrepresented in medicine, psychology, pharmacy, and nursing, and that's the logic hat. These are people who naturally want the information, the data, ask questions of it, immediately spot the gaps between what the X and the Y axis say, or that the slope has been represented as this, but actually is something else. And they just feed off information. Now, there's nothing wrong with that. In fact, it's absolutely vital. But I suppose the point from the conversations we've had today is perhaps one way the logic hat could be thought of is, are we getting enough of the right sort of information to help us make the right sorts of decisions, rather than just looking at the information that somebody else presents to us and finding problems with it, or issues that we feel are inaccurate or don't represent the reality as we see it. So using those characteristics in a positive way to move forward, rather than in a way to bring everything to a grinding halt and make the person presenting the data become defensive. Next slide. Logical negative hat is somebody who definitely focuses on the gaps and why this won't happen, and often ground some of those comments in their experience or in a strategy or a policy document that says this, or sometimes indeed their ethical approach to, well, we can't do that because. The point about this is this too is important, because these perspectives may not just be in the team. They may be outside in the environment or with other people that you're going to have to work and negotiate with to make progress. So understanding how you can benefit the logical negative hat is really important. Thinking about what others might say about the data or the proposal, thinking about how it interprets the policy and how you might come back if somebody says, well, this isn't what it says in the NICE guidance, for example. Being prepared, of course, is a very valuable way of dealing with barriers and opposition, or indeed the unexpected event, rather than just having to face it out of the blue. So the sort of thing somebody might say is the current pressures on bed means we can't implement this fully. In fact, we heard an example of that, didn't we, today, where CUMTAF had pressures on beds and thinking about admitting all their patients, but finding a way to do what they intended to do, but not admit all the patients, because they recognise that there is a capacity issue. So keeping the purpose in mind, but not getting distracted by certain viewpoints from other people, which in many cases and in this were very justified. Next hat, green hat. Now, this is probably my preferential hat myself. I'd wear a green hat every day if I could. I'm always coming up with new ideas, possibilities, and I'm sometimes the person that chucks into a meeting some completely mad thing that I've just thought of in order to provoke people to think differently about what is being considered, because sometimes I get a bit frustrated and possibly bored, or I used to, in leadership meetings in the hospital when people are just going round and round the same circles over and over again. So a green hat can be quite a difficult thing to manage, but a green hat also could be put to work thinking, what are the alternatives to this? Sometimes if we never ask the question, we don't give people the opportunity to put one forward. How could we do it differently? It sounds like a crazy question, but unless we actually put it out there and get people thinking differently, then we're just going to carry on doing more of the same. So actually the green hat, given the right script, can be a very useful tool just to chuck into the conversations, well, what haven't we thought of? And you know, are we really just getting stuck in the normal way of doing things? Perhaps there's something different we could do here. Next slide. The feelings hat, very important too in our work. We all know that feelings really matter, and that we all have a passion for our work and a passion for the way we do our work. And that's absolutely vital and important. And also sometimes feelings that something isn't quite right or wouldn't quite work, or what we're missing here, are really, really important. We overlook people's feelings in a meeting to our detriment, and possibly building in failure into our project. And so asking people up front, does anybody feel really uncomfortable about this approach? You know, because we're talking about testing something out. What do people think about this deep down? Does it fit our purpose? Is it really the right thing to do in this situation? Has anybody got any intuition that's telling them that this might have some unintended consequences? A very important way of harnessing those anxieties that some people will feel more easily than others, and bring them to the fore so that we can prepare for them and make sure unintended consequences aren't the outcome. Next slide. The benefits hat. We can all think of how good it would be if we put into practice our idea. Sometimes we need to get somebody who's a bit skeptical about it to think about how the benefits would be assessed or measured. Sometimes it's very easy to get carried away with our own positivity. And so really asking people to think very critically about how would we know that this was an improvement, a vital quality improvement methodology question. What are the advantages of savings, and are they real? Or are we at risk of losing them by not thinking seriously? And that really does flag up the issue about virtual consultations. Yes, they are less costly. Yes, they are more flexible. Yes, they are easier to do in the situation in which we're all currently living. But what are the disadvantages? What are the possible consequences in cost and benefit terms that we haven't thought about, that we must offset against our desire to do things in a more efficient way? If we're losing effectiveness by being more efficient, we're not sticking to our principles of keeping all those 6 parameters of safety, timeliness, effectiveness, efficiency, equity, and person-centered in the forefront of our mind. Next slide. And the control hat. Definitely, this is a characteristic many of us will have, and we probably are or have been in responsible roles where control has been part of our actual job. But sometimes that is a tendency to over-control the situation and not allow the situation to be opened up a little bit to new ideas and new thinking. Look at the data. What's it telling you? And if you've collected it real time, that data will tell you that what you've been testing and what the theory you've been trying out is actually starting to show an improvement. So that even if somebody does want to control the situation in a different way, you can give them the evidence that would counter that and would at least start a conversation that might lead you along to testing out a little bit more thoroughly in more different circumstances and collecting more information. That's much better than having a block put on the plan completely. And if we can combine all these different coloured hats together, either in sequence by all wearing one at once and then moving on to the next one, or by all taking on a different approach, then we'll bring a much richer conversation and a much more valid grouping of ideas and plans to go forward with than we would otherwise have done. So check out the booklet in the online link that we've sent you just for some more information, and think which one you are by nature, and think which other one you might have a go at being. And in your next meeting, use the little prompt sheets that we've put in the workbook today. I think they're on pages 4 and 5 and 6, and just have a practice at using this approach.